Good evening, class. Welcome to Kines 302, the kinesiotaping method. My name is Charlie Ramos, and tonight we're going to be covering circulatory lymphatic correction of the knee. So first, let's go through what our learning objectives are going to be for tonight. So choose the correct KT application. That'll be the first thing. Next, we're going to apply the correct amount of tension on the KT for lymphatic drainage. And third, apply the correct KT technique for a knee specifically. So as we go on, you're going to see how these are going to be important. As doing this technique correctly is going to be critical in getting the right outcomes from your patients. So the first thing that we want to do is cover some background about the tissue healing process. So as you can see here, we have a patient with a knee contusion. And so during this initial period of an injury, when you see swelling, when you see bruising, there's lack of range of motion, that's when this lymphatic drainage or lymphatic correction kinesio tape job is going to be most appropriate. And that's going to be really important. Everyone needs to really understand that depending on what you're trying to accomplish with your patients, that's going to dictate what type of kinesiotaping technique you're going to use. This is not going to be optimal for someone, let's say, that has a muscle spasm in their back. There's other techniques for that. So let's get into the tissue healing process just to really understand what we're trying to do here. So we have three phases: the inflammatory response phase, the fibroblastic repair phase, the maturation remodeling phase. So as you can see here, these three phases, they all overlap. One doesn't have to end before the next one begins. So the one that we're going to really focus on today is the inflammatory response phase. And that one lasts between 48 and 72 hours in most people. And this is when the patient is going to experience a lot of different symptoms. So those symptoms being redness, swelling, tenderness, increase in temperature. And as you can see here, this patient has a lot of swelling. They're going to have decreased range of motion. It might be hard for them to put weight on their ankle. And as clinicians, we're trying to get them to the next, rehabilitation phase, right? Which would be, increase their range of motion, get rid of pain, in order for them to move on to the next phase, which would be strengthening and doing more functional activities. So how do we do that? Well, typically, in most rehabilitation cases, you're going to use rest, ice compression, and elevation. This has been one of the protocols that has been used for decades to help someone recover from a significant injury, especially in the first few days, first week, a couple weeks. This is the type of treatment that the patient is going to receive. Well, if we're trying to get to the phase where they're working on the range of motion and they can do it with less pain if possible, we also want to start applying other techniques, right? Therapeutic exercises, some modalities for pain. What if we can add kinesio tape? What if kinesio tape will allow us to reduce that swelling a little bit faster, help us get a little bit more range of motion? That might be a great tool to have. Well, let's see what the literature is saying about that, because so far the evidence is somewhat inconclusive. Some studies are saying that the kinesio tape has no effect at all when used by itself. It has no effect on swelling, while others are saying when you combine it with another therapeutic modality, there could be a positive effect. Well, our first study here by Pekivas and colleagues combined complex decongestive therapy to KT in patients with lymphedema. After 10 days of doing this type of therapy, they found that this group, compared to a group that only used CDT, had decreased edema at a faster rate. Our next study by Aguilar Ferrandez showed that KT may reduce venous symptoms, pain, and increase gastrocnemius muscle activity in patients with chronic venous insufficiency. However, in this study, they were not able to show a significant decrease in edema compared to a placebo tape job. And finally, in the last study, we have Nunez and colleagues. And in this study, they showed that there was no difference between the experimental group and the group that received the placebo tape job. But in this study, they applied the tape job for only 3 days, and they did not use any other form of of therapy. They did not have therapeutic exercises or modalities, and the study was only done, or the tape was only kept on for 3 days. In my experience, I've found that to see significant differences, at least anecdotally, um, we keep the tape on for at least 7 to 10 days. And that doesn't mean keeping the same tape on. That just means that because the tape job typically stays on for 3 to 4 days, so we change it every 3 or 4 days. We take off the old tape and then apply a new tape job to it. So all this to say that when considering using kinesio tape for edema, it shouldn't, it shouldn't be your exclusive rehabilitation tool. You should uh, use good clinician common sense and research to tell you that no, one tool is not going to help me fix everything. It should mainly be used as a supplement to your other rehabilitation techniques. So now that we have some background on when we're going to be using the kinesio tape, and so far what the evidence is saying, let's go ahead and see how we're going to apply this, how we're actually going to use it. So I'm assuming that most of you read your textbooks, so we're going to take our first little quiz here, and the way we're going to do this is through an online poll. So everyone go ahead and take out your phones, and you're going to text and open up your text app. So text Charles Ramos 572 to the number 22333, and you're going to receive a text back saying that you are now part of this poll. So the question is, what is the correct KT application for swelling? We have A, I-strip application, B, fan strip application, C, Y-strip application, and D, X-strip application. So everyone go ahead and text your answer, and let's see what we get here. And it looks like most people are texting in the answer B, which is fan strip application. And that would be the correct answer. So let's find out a little bit about the fan strip application. So the anchor, which is this portion of the tape job, is 1 to 2 inches long. And then you're also going to have 4 to 6 tails that you have to cut through. So you're going to cut these tails. The other thing to note about this application is that the ends, so the last about ½ inch to ¼ inch, are laid down with no tension. So when you're laying this tape down, there should be no tension on these ends. And for that fact too, the anchor will also have no tension. So let's look at our learning objectives. So choose a correct KT application. So we just found that out right now. Our next learning objective is to apply the correct amount of tension on KT for lymphatic drainage. So how much tension? So let's take our next quiz. So if you're on that same text thread, you can answer that through that. So it says, how much tension is applied to a lymphatic correction KT application? So A is 0%, B is 100%, C is 50%, and D is 20%. So let's see what most people are texting here. And it looks like most people are texting A, which is 0%, or D, which is 20%. And both of those answers are actually correct, because for a lymphatic correction tape job, the tension in the tails will be between 0 and 20%. So let's talk a little bit about lymphatic correction. So It's used to assist the removal of edema. And the way it does this is that once you lay down the tape, there's going to be recoil on the tape. And with that recoil, it's pulling that skin that you just laid the tape over, it's pulling it in that direction of the recoil. And it doesn't do this in like a way that you can see it all the time. It's usually at a very small level at the epidermis level. So you sometimes you won't be able to see that. However, it creates these little wrinkles every, every time it pulls the skin. So there's these very small wrinkles which create areas of decreased pressure under the skin. So that's kind of how it assists the lymphatic vessels to um, to work a little bit better. And finally, the clinician should properly assess the patient to determine the best use of KT. So making sure that, yes, this is the correct technique that you want to use. That's done with a proper assessment of your patient, making sure that this is the best way to treat your patient. Okay, so we've gone through the correct KT application. We've applied the correct amount of tension. And now we want to apply the correct KT technique for a knee specifically. So let's look at that. So our third and last quiz here. So let's see what the question is. So it says, how should a KT lymphatic correction application look like for a knee? So here we have 4 pictures, A, B, C, and D. So again, you should have read the material for this week in your textbook. So, and I know there's several pictures of what it should look like, so you guys should know what this looks like. Let's see what most of you guys answer here. Okay, it looks like all of you are answering correctly, which is B. So it is this picture right here. And it looks like 2 fan cuts and they're crisscrossing each other. And so now we'll cover what that whole process looks like. Okay, so the knee lymphatic correction technique. So first you have to create 2 fan cuts, so just like the ones that we just saw, and they're each going to be about 6 inches in length. The anchor, again, is going to be about 1 to 2 inches, and you're going to place that anchor above the joint line. In this case, we're working on the knee, so the anchors have to be as more proximal than the area that you're working with. So in this case, it's going to be above the knee joint line, and you want them pointing towards the nearest lymph node or lymph node in that area. So in this case, you can see that this clinician pointed this one towards the greater trochanter, and the other one is pointing more towards the groin. And that's the direction that the tape is going to be pulling. So it's going to be drawing the skin in that direction. It's going to be pulling it upwards too, giving some space under the skin there. The other point to make here is that the patient has his knee flexed here. So whenever you're laying this tape down, you want to make sure that the tape is going to be able to move in as much range of motion as your patient has at that time. So in this case, let's say this patient has significant swelling, so he's only getting about maybe about 90 degrees of flexion, maybe 110, 120, and that's as far as I'm going to bend his knee, and that's how I'm going to apply the tape. If my patient is able to get 140, 150 degrees of flexion, then that's how far I'm going to bend their knee, and then I will apply the tape job. So then you apply the tails with 0 to 20% tension, and you lay the ends with no tension as well. So in summary, when using KT as a supplement to assist in reducing knee swelling, we're going to apply it with 48 hours after the initial injury. So once the inflammatory response phase has ended or is about to end, a fan cut will be used, 0 to 20% tension on the tails. The patient's knee will be flexed as much as possible, and then the anchors are laid down approximately above the knee joint line. So here are the references we used. And if you have any questions, I'll take them right now before we start our lab and practice this tape job. Otherwise, thank you for your time. Thank you for listening to this lecture, and I hope to see you soon.